Let's chat about the common mistakes that you're probably making in your digestive health and what you can do about them. I'm Dr. Laura Pfeiffer. I am a naturopathic doctor, and I've developed the Her method, which helps take her hormones from chaos to calm. Now, one of the biggest things that we overlook when it comes to your hormones is digestive health. So, I like to talk about gut health with a lot of my patients. Whether you're dealing with bloating, irregular digestion, or just want to improve your overall wellness, your gut plays a huge role in how you feel every day. But with so much information online in today's world, it's really easy to get sucked into the latest and the greatest that we see on the internet. And so in today's video, I'm going to talk about the most common gut health mistakes you might be making and how we can step away from those mistakes. Mistake number one is loading up on probiotics without a plan. So, probiotics are often marketed as the ultimate solution for gut health. And while they can be incredibly beneficial, they are just not one size fits all remedies. If you're taking a probiotic without understanding what your gut really needs, you might not be getting the results you expect, or you could actually make your symptoms worse. In the case of small intestinal bacterial overgrowth, also known as SIBO, what we often find is that probiotics make symptoms worse. Why? Because the specific bugs that are in a condition called SIBO actually fuel themselves on some of those probiotics, which can cause more fermentation, more bubbling, which causes more bloating, more gas, more abdominal pain. And so that's the first place where we could be going on wrong with probiotics is we've actually got at the wrong diagnosis, and this is actually the wrong treatment path for that diagnosis. The other place when it comes to probiotics is understanding what exactly is there. So when we have an ecosystem, if we think of the gut like a garden, typically we're creating an ecosystem of microbiome of specific bugs. And in that ecosystem, everyone is working together within one another. And so what we need to understand about that is if there are bad bugs overgrown, think of them like bullies. If a probiotic, a good bug comes in and tries to take over, what's going to happen is it's going to either be spit out or killed. And so when that happens, we're no longer having the beneficial effects of the probiotic. So you might actually take the probiotic and find that it actually does nothing. And that's because the bad bugs are deactivating it in some way, shape, or form, or they're actually just leaving the body right away and not taking residence in the microbiome. And also, not all probiotics are created equal. Different strains serve different purposes. Different products have different quality levels. And so there are certain strains that will treat bloating, certain strains that are going to be more targeted towards autoimmune conditions. And so we need to make sure that we are understanding what's going on if the probiotic is the first step. And if it is the first step, what strain are we using? The second common mistake is ignoring the impact of stress on your gut. Have you ever suffered from anxious tummy or not been able to go to the bathroom for a few days after you've had a really stressful event? This is because the nervous system plays a massive role in how our digestive system responds to things. And we need to understand that when it comes to the nervous system, we need to be in rest and digest in order to actually digest things and absorb them properly. And so when we think of gut health, oftentimes we think about it as a purely physical issue, but we need to look at the gut-mind connection because it is extremely powerful. Chronic stress can actually impact the way we activate digestive enzymes and cause bloating, cramping, and changes in the microbiome. We actually know that long-term stress can impact the microbiome, the gut ecosystem, if you will. So if you're focusing solely on diet and supplements while you're ignoring stress, you're actually missing a huge piece of the puzzle. Managing stress is just as important as managing your diet when it comes to gut health, and incorporating stress relieving practices into your daily routine and actually saying no to things and setting up really clear boundaries can actually help that long term. Mistake number three is falling for the all or nothing diet trap. There's actually a lot of pressure to follow strict diets when trying to improve gut health, whether it's cutting out entire food groups or sticking to an ultra clean eating regimen. But these extreme measures can actually do more harm than good. Restrictive diets can lead to nutrient deficiencies. And I always tell patients, even if you're eating a healthy diet, if it is a basic and repetitive diet, you are not doing your microbiome a service. You're actually doing a disservice, because one of the things, the core principles of creating a healthy, balanced microbiome is actually creating diversity. And the way in which we create diversity in a healthy microbiome is actually through consistently changing up the variety and the types of fibers and the types of food that our body is exposed to. So, not to mention, just solely eating the same thing over and over or restricting the diet can actually create deficiencies. But just understanding that we also have to look at it big picture, and the certain bugs that like to feed off certain foods will create that diversity. And we know the research tells us that diversity in the diet creates diversity in the microbiome, and that actually leads to more positive health outcomes. In addition to that, I see patients on restrictive diets like the Candida diet or a SIBO diet. And oftentimes, when we have a bug overgrowth, let's say that it's Candida, for example. Candida is a yeast. So if we have a yeast overgrowth, a lot of times patients will be put on these restrictive anti-Candida diets in order to solve the problem. What the major problem, major roadblock is with doing that is that we're actually just contributing to the lack of diversity and food restriction. And then what happens is, if we've actually not killed the Candida, if we've just taken away every single food that it feeds off of, the vinegar, the sugar, the fruit, the bread, as soon as we reintroduce those pieces, we're now in trouble from a gut perspective. We're now just going to grow that back. I like to focus on figuring out what's there, removing the overgrowth, and working towards a whole foods diet with lots of variety. Even if that means that for a short period of time, we're focusing on a little bit of restriction or removing certain foods, eventually the goal is to get back into that variety diet and not be stuck in that rut. Instead of following this all or nothing approach, I like to aim for balance, incorporating a variety of foods, lots of fiber-rich foods, and not being afraid to include foods that bring you joy. Mistake number 4 is the over-reliance on supplements. Supplements can be a helpful addition to your gut routine, but they should not be the foundation. Relying too heavily on supplements while neglecting the basics, like a balanced diet, like adequate hydration, regular exercise, can actually lead to an imbalanced approach to health. I encourage my patients to focus on the basics before turning to supplements. And even when it comes to supplements, specifically for gut health, I like to have a timeline and an end date for all treatment interventions, which means for digestive health, you're always driving towards something. We should always be treating the next thing, creating a solution for the next problem without saying these are your forever supplements. It is a little bit of a red flag when your practitioner just gives you a probiotic and says, here you go, you're going to be on this forevermore. The only scenarios where that is appropriate might be in conditions like ulcerative colitis or Crohn's, in a autoimmune condition where we know that there is inherently microbiome issues. We may choose to add in a probiotic long term. In a pregnancy, we know there's evidence that being on a probiotic long term can actually reduce the A to P triad in babies. And so understanding that is actually really important to deploying a protocol that makes sense. And probiotics aren't cheap. And so I tell patients that unless there's a specific reason why, if we are, re-inoculating the system and we're adding back in a probiotic, normally I will do that for 30 to 60 days. And then I will take you off of that if you are my patient, because oftentimes you should have a digestive system that is able to house those strains of probiotics rather than constantly, daily having to take them orally. And so we need to focus on the basics. We need to make sure we're having a balanced diet, rich in fiber, staying hydrated, regular physical activity. Once we have the fundamentals covered, we can actually start to level up into the health optimization realm. But when we look at the foundations of gut healing, we have remove, replace, reinoculate, repair, rebalance. Rebalancing is all about focusing on what got you there in the first place. Your supplements can't out-supplement a poor diet and lifestyle. They're not going to help you with the microbiome changes that come from chronic stress or a sedentary lifestyle or a poor diet. And mistake number 5 is not getting enough fiber. Fiber is essential for gut health. It helps create short-chain fatty acids, which is going to lead to a lot of the benefits we see from fiber. It helps with microbiome diversity. It helps to lower inflammation. It helps to balance blood sugar and reduce cardiovascular disease. So most people don't get enough fiber, whether it's due to a low-carb diet or simply not prioritizing fruits and vegetables. A lack of fiber can lead to digestive health issues like constipation and an unhealthy microbiome. If your diet is low in fiber, it's important that you take inventory on that, and slowly increasing your intake to the recommended amount can take some time. The overall recommendation for the most population, the majority of the population, is 25 to 30 grams per day. But this can change based on the individual. So it's important to speak to your healthcare provider to make a goal or set a goal that makes sense for your unique needs. Your bacteria in your gut needs to feed off of something, and fiber is a core source of fuel. So improving your gut health doesn't have to be complicated, but it does require paying attention to what your body needs. By avoiding these common mistakes and focusing on personalized, balanced approaches, you can take control of your gut health and start feeling better. Remember, your gut is actually the center of your overall health. So taking care of it is one of the best investments you can make in yourself. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more health tips. If you have more questions, please book a call with me and let's dive deeper into your gut health and learn how we can make the best impact.